Good afternoon. And today I have a pleasure of interviewing Doctor of Sleep Medicine, real sleep expert, Dr. Alison Kole.
Thank
Good
you so
afternoon.
much for having me.
And thank you very much to my audience. If you have trouble sleeping or sleep next to snoring partner, this program is for you. Because we're going to share, Dr. Kole going to share a lot of tips how to make your sleep better, how make your days full of energy. And if you're a medical professional who, just like us, so passionate about our patients, helping our patients to sleep better, please listen to our program and share with your colleagues and friends. And you can follow our podcast on the Facebook, Sleep Apnea Briefing Snoring Help, on the LinkedIn, YouTube, or follow me on the Instagram, Dr. Maria Sokolina. But you can also follow Dr. Alison Kole. She has an amazing podcast with a wonderful name, Sleep is My Waking Passion. So listening to that podcast, you're really gonna have best sleep ever possible. So I'm going to start, just like I mentioned to our audience, and people can find a lot of information about you on your website, and it's a great blog, and I was there and I find so many great tips. And I'm going to ask you about the questions what I get asked a lot these days, and I'm going to start with sleep hygiene. And I listened to your presentation on Philadelphia sleep, so I want to start with that. And we are so much into biohacking, and one of
Yes.
these cool biohacking tip, I have this wearables, and this becomes so popular for improving sleep quality that I use it myself every morning for 30 minutes. And tell me about those biohacking devices. How do they really improving our sleep, because you have such a high understanding of sleep, and can it be effective for people dealing with insomnia or other sleep disorders?
You're asking a multi-layered question, and I love all of it. So sleep hygiene really is a set of behaviors, what we do to kind of prepare our us for good sleep. And a lot of times it gets kind of a bad rap, meaning that people seem to know, okay, well, you told me like my room is dark and it's quiet and great. Um, you know, what else do I really need to do? That's not really going to fix my sleep. That is but one layer of getting to better sleep. I look at sleep hygiene is remember that what you do during the day also impacts what you do at night. So if you haven't given yourself a moment of peace and you've been running 1,000 miles an hour, and then suddenly it's nighttime and you've been going without a break, and then you expect to just turn everything off and go to sleep, that's an unrealistic expectation, right? So being mindful of creating a bedtime routine that will work for you, and then creating a bedtime environment that is conducive to sleep. Very cave like is the way it is. Cool, dark, quiet is traditionally what we recommend. Now, there are some people that really have busy brains and they actually prefer some sort of a distraction or a white noise machine. Different strokes for different folks. And I'm not here to tell you there's only one way to sleep. The key is to find out how you sleep optimally. And it's okay to play around. There's no, I just did a post today. Perfection is the enemy of sleep. If you're trying to create everything so that everything is so perfect, sleep becomes more elusive because life isn't perfect. So it's almost like having a mindset and attitude adjustment just in terms of how you approach everything. And you're talking to a type A perfectionist leaning person. So believe me, I know these things. In regard to the IO glasses, what you see that Maria's wearing, and I have a pair as well, is you see that there's a light that's going into her eye. The way I find this to be profoundly helpful are two main conditions. I'm not saying this is the only way that you can use this, but what I find is when I'm trying to really make sure I'm getting someone entrained with their circadian rhythm, and if they have seasonal affective disorder, And what this translates to is summary. It's like a portable light box that you can take with you wherever you go and whenever you need to see bright light. So let's talk about, just some of the things that happen in the United States, which can be quite frustrating. The one being this whole idea of we've got to do daylight saving time and then we go to, standard time. We've got to flip the clocks back and forth. It's also silly because we should all just be on permanent standard time. Why does it matter? Well, depending on when you have to get up to start your day, and it doesn't matter where you live, there are many people, up to 20% of people in this country that do shift work, for example, that really do need to get up and sort of start things at a time when it's going to be dark out. That's exacerbated in the winter just because we have shorter days. That's not about clock change, people. We just are going to have shorter days because it's how the earth is rotating around the sun and where we are located. Okay. But when we have shorter days and it's dark in the morning, it is much harder to get moving. And I've even experienced that even in the summer, the light's going to start kind of peeking through. Sometimes it's, 5:45, 6:00 in the morning. That becomes later in the winter. And that's a great time to start. But even the light peeking through, I live in Jersey and we've had quite rainy and quite gray days. It still doesn't feel like, oh, the sun's out. Great. I'm ready to go get some bright light. Ideally, you'd go out and get sunlight when you first can in the very beginning of the morning, and you'd sit outside, take your shoes off, ground to the earth. All that stuff is
Love it.
really, there is truth to it. Even if it sounds hokey, there's truth to it. It's really kind of getting back to our basic biology as humans. Let's peel back all the technology and all the fancy stuff. Unfortunately, the reality is that when it's dark and we still need to get going, or it's really raining, and I'm not going to go sit outside in the rain just because, using glasses like this can be really helpful. The idea is that you don't have to sit in front of a light box. Light boxes can be a little bit cheaper than this. They also have ones that are even more expensive. But it's, if you are a busy professional like Maria is, like I am, what ends up happening is I'm up and then the day is starting. There are tasks that need to get done, and sitting for 30 minutes and just being in front of a light box, that sounds great. And maybe for some people, they'll use that as a meditation tool. Fantastic. That is not my reality. I would feel very annoyed by that. I would not be compliant with that because I'd be like, I have so many things I could be doing in this 30 minutes that I'm awake. What am I doing sitting here in front of this? So the IO glasses make it really easy for you to basically walk around. I'm doing dishes. I'm packing little snacks for my kids and making sure their book bags are all tucked. I honestly am cleaning up from the night before because sometimes you're just tired at the end of the day and you got some dishes that got to go in the dishwasher or a load of laundry you want to throw in. Basic activities of daily living. And I would highly doubt that the majority of us don't have the exact same situation, particularly when you have a busy life at home. So I love it for that purpose. Light boxes can be very good if you are feeling sad. I am not going to tell you I have reviewed the literature for IO glasses specifically in seasonal affective disorder because that would be incorrect. But it stands to reason that if you know what's going to help you with your mood is trying to kind of get some light in your body to sort of think about light, this is a great portable tool. The other thing that it does, particularly when we're trying to set our circadian rhythm, one of the reasons that we as humans can wake up almost if we wanted to, and we were regimented the same time every day, is because we are getting entrained by the sun. If there was no sun, all of us would be wackadoodles because we would never figure out, like our circadian rhythms would be all over the place. And we know this because there are people who unfortunately suffer from blindness. And they're a small segment of the population, but if they cannot sense any light, you will see their circadian rhythm marching around the clock. So that is a real phenomenon. So we know that that would occur. So being able to create a schedule and a routine with our sleep and our bedtime routine and the activities that we do, making sure we're getting consistent exercise so that we're mentally stimulated, but also physically stimulated. So we're physically and mentally ready to go to bed at night. all of this comes full circle. So, getting light when it's dark kind of helps. It helps you to start your day, and that'll also help you start your day tomorrow and the day after that and the day after that. And that builds sleep consistency, and consistency, sufficient duration, and sufficient quality are like the big three things that we need to do. And this is how sleep does what it does in terms of assisting us with our health. So
Fantastic.
our bodies want consistency. We're giant children. Never forget that. I've got a Hello Kitty tattoo. Actually, I have two to remind me that we are forever children. And just like we have routines for our kids, we got to have routines too.
Yeah, that's very important. And I think I want to ask you about specifically women. So women experience disrupted sleep. And a lot of people contributed to menopause or premenopause, or we can say in general, hormonal changes. What specific advice you can give to women in, I don't know, like I would say in this stage of life, but this stage of life can be quite lengthy stage of life, how to improve the sleep quality and manage symptoms.
All right. This is where I'm going to get real holistic with this discussion. A little bit less prescriptive and scientific and a little bit more holistic. What we know scientifically is the minute that we as ladies start to hit puberty, this is where we start to see the quality of sleep diverge between boys and girls. It's really that puberty. And because why? Boys, their testosterone increases when they kind of are done with their puberty. It kind of stays. And then as they get older, it sort of gradually dips. So it's sort of an up and down, but it's pretty predictable. Women, we cycle. So even the process of cycling in your period years, your sleep may change literally week to week, depending on what stage of your menstrual cycle you're on. So that's one thing to keep in mind. As we age, and then we hit perimenopause, and perimenopause is sort of the precursor to menopause, where we fully stop having our periods for a year. What happens is your hormones are up and they're down and up and down. So you have like progesterone up and estrogen up, and then they're down, and they're just wacky. They're all over the place. And we start to see the results of those hormonal fluctuations impacting our sleep as well. Then we get to menopause, and then we have a lack or a paucity of progesterone and estrogen. This hormones are where we're kind of, that's where we're at. And the reason that's important is because those hormones actually impact our sleep quality. Estrogen can have kind of indirect as well as direct effects in the brain. And it can impact the thermoregulatory center, which, if I recall correctly, is in the hypothalamus region. And that, of course, is think hot flashes. So that can impact your sleep. Then you have progesterone, which is our chill pill. It's our body's chill pill, our body's glass of wine. If you're a wine connoisseur, the reality is we can take a step back. We can relax. When we have it naturally, it's easier to relax. Progesterone also helps to stabilize the upper airway. So we know that that's important. Then you have thrown pregnancy. If you're somebody who is pregnant, what we know is that there's some of the tissue can swell. We have some weight gain. We have the child. So sometimes we see things like sleep apnea start to creep in, or if we don't know we have sleep apnea and we go through pregnancy, sometimes the manifestation is that we have pregnancy complications. So it's much earlier, sort of more nuanced research, and research that we need a lot more of, because women have largely been ignored in research in the 70s. But it's really complicated when it comes to women. And what I'm trying to say is we don't know everything. So the reason I get back to what are practical tips that are holistic is I think we as women need to just look at what society is telling us our responsibilities are, what responsibilities we place upon ourselves, and we need to start to manage some of those expectations and those feelings. I say that very very specifically because I've been through that experience. Maria, you may have been through that experience as well. And a lot of women, especially professional women that are managing a career, they may be managing a family and a household. They, even if you don't have kids of your own, you be managing your aging parents. There are a lot of caregiver type of responsibilities that women tend to assume. They're all wonderful. I am not here bashing any one of them. I am internally blessed. I get to do any of the things that I get to do. But when we have caregiver responsibilities, and then you have a professional responsibility, you will notice, if you really think about it and hit pause and observe what the expectations are of a man who's working professionally versus a woman working professionally, we have two jobs, and society has sort of dictated, listen, you kind of have two jobs. You've got to be the caregiver. You've got to do this. And then you've got to have this professional career. And if you get to be professionals like us, one of the components is self-sufficiency. At least that was burned into my brain, be it cultural, otherwise. But I was taught you were going to be a successful, strong woman. You don't need to rely on anybody. You're going to manage this. That's great when you're trying to get through med school and residency and you want to conquer the world and build your career, right? All of that sounds terrific. But the flip side is that you can take that same approach and then you're thinking I'm Superwoman. Because God's honest truth, I really thought I could do it. I really was like, all those people that talk about burnout and stuff, that can't really, that's like not going to happen to me because I'm tough. I'm strong. I can handle it all. And sometimes we're not good at creating boundaries because we fear that creating boundaries is going to lead us to not be successful in one area of our life, but it bleeds over into other areas of our life. And one of the things I see with women a lot is this sense of a loss of boundary, a loss of the ability to say, I need to delegate. That responsibility can't be all me. I countless. I really, just like you, Maria, and we were just talking about this on the Sleep is My Waking Passion podcast, how you really care to have conversations with your patients. It's one of the reasons I went to direct specialty care so that I could have really deep, meaningful conversations that take time with my patients. Regular medicine does not allow that time. It's because you got to churn and burn. You got to go through your next. But I will hear this theme of, well, I'm taking care of mom. I've got to do this. I'm not sleeping because I've got to run over here and run over there. And it's amazing how many times I'm like, whoa, let's hit pause. Do you have siblings? Oh, yeah, I've got a brother. My neighbor even. She mentioned how she's really the matriarch. She's the one that is the glue that holds everything together. Her brother would be like, I can't really take care of mom this weekend. I've got this thing going on. And so she's like, well, now I've got to go over there. I've got to manage it. And I'm like, this is the kind of thing where we can work toward. I'm not saying it's easy, and I'm not saying people in your life who are used to you not having boundaries are going to be very happy with you. It causes discomfort. But I want you to get a sense of what I'm saying is I want you to make yourself a priority. If it feels good to splurge on a mani-pedi, like I did, do it. If it feels good to get that facial, do it. Prioritize yourself. And what you will find is that when you don't make excuses and allow other people to kind of put their things that they could be assisting you with, and if you learn how to delegate, basically, things are going to get done. It's going to be uncomfortable at first. Some people aren't going to like you for it. Who cares? Because you need to protect your own peace. That would be my number one thing for you to reflect on if you're having trouble sleeping, because there's probably a theme about you having trouble sleeping.
This is a beautiful advice. Thank you very much. And you can get actually care of Dr. Kole. She's a practicing sleep medicine physician in New Jersey, and you can find her through her website or through her channel, Sleep is a Waking Passion. And you can follow her on Instagram. And we're going to post this interview. And you can find her, ask the question underneath the interview, and we're going to find you the answer. Thank you very much, Alison.
Thank you. Can I add one more thing?
Absolutely.
I want to get now to a little bit less hokey holistic, which is I want every woman listening to this to understand, be it premenopausal, perimenopausal, postmenopausal. I talked about hormonal changes, pregnant, right? I talked about hormonal changes over the years. If you are someone who is finding that you were having little sleep disruptions, you may not even really call it insomnia, just that your sleep is disrupted a lot. Or, you're finding that you're truly waking up and you can't get back to sleep. And it's not just about your busy brain shutting down and allowing you to get to sleep, but truly it's like you're just never quite getting that rest. You may not have a bed partner who tells you you snore. Many times women may not obviously snore. I want you to think about whether or not you have obstructive sleep apnea and your particular manifestation is insomnia or disrupted sleep. Very important. A lot of y'all are scared. You think you're going to be on a machine. Oh my goodness, I can't possibly wear this. I've literally had women concerned, and I get it, about creating lines on their face because girls, we have our fancy creams and lotions, right? And we wear them for a reason. We want some nice, smooth skin. And unfortunately, sometimes CPAP straps can be an issue with that. They make pads to help you. But the bottom line is, if we're looking overall at your global health, it is missed and underdiagnosed. Obstructive sleep apnea is missed and underdiagnosed in so many women. The other thing is, a home sleep apnea test is a wonderful tool. I love it because it's very easy to screen people who are really struggling with their sleep. And we're not quite at the point where I love the home sleep apnea tests that are multi-night that will give me positional data. Positional data, I think, is very helpful and important. So right now, I just do the one-night testing, though multi-night testing may be the wave of the future, provided they can
I
increase
hope
the
so.
reimbursement, right? So that may be what we need, is just multi-night testing for y'all. But if your home sleep apnea test is negative, many times because women tend to have more mild disease, more upper airway resistance, so their airway's not collapsing, they don't have the same degree of desaturation, drop in oxygen levels. It doesn't mean it's not significant, particularly if you feel like crap when you wake up. Your symptoms are most important. So if that's the case, your doctor may suggest either a home polysomnogram. That's an out-of-pocket cost, but considerably cheaper than going to the lab. And that is something that I provide with my services.
Fantastic.
Or I'm happy to just fight with the insurance company and see where I can get you in, so that you can go for a polysomnogram. And the reason I'm pushing so hard and encouraging you to get tested is because we do miss cases. Even in the highest probability, obvious patient, we can miss up to 10% of the cases. And if you really kind of drill down, that percentage goes up the kind of lower risk you are, or the more vague your symptoms are. So
Wow.
that would be the other sage advice, especially since it's so strongly tied to what you do, Maria, is don't let disrupted sleep just be a thing that happens because you're a woman, because that's crap.
Thank you very much. Thank you very much. It's such a caring advice. And I like how you talk about home polysomnography, or I heard about cannula sleep study in lab, but also can increase the chances of diagnostic upper respiratory resistance syndrome, and it can be, eye-opening to a lot of women. So thank you very much, doctor, and people can find you. And I want to mention, you briefly said about CAMISA, sleep apnea and insomnia together, and you talk a lot about it on your blog. So it's a very valuable information, because a lot of patients have CAMISA, and of course they're very scared of the machine. But I think with the great care, it can all be managed and overcome. So thank you very much.
Yes, I'm going to be part of Airway Coach's Spring Virtual Summit that is occurring later on this May. So please sign up, check it out. I'm going to be talking all about COMISA. So thank you for reminding me of that, Maria. I appreciate it.
Thank you.